Dr. Muhammad. How are you doing today?
Hi, Kamryn. You're welcome.
Okay, so is it okay if I speak to you and then you translate? Is that okay?
Yeah, it's okay. You can go.
Okay, so could you just let Umar know my name and ask him what his name is for me?
All right. So, me sunanka? Okay, to sunanta Kamryn. Kamryn ko? Za ta tambaye ka. Ko komai da komai. All right. He says his name is Umar Al
Okay.
Hassan.
Hi, Umar. Could you just ask him to let me know a little bit about his home life and what he does for a living and what's been going on the past few weeks?
Okay, to me aikinka? Yawa komai. Kuma kana zaune a gidanku kai ko? Okay. All right. Kamryn, Umar says he's a 22-year-old student who live with his parents.
Okay.
Um,
And could you ask him to tell me a little bit about his symptoms and why he's at the hospital today?
okay, me damuwan naka. Okay, zazzabi ko? Da ciwon kai, da ciwon nan. All right, Kamryn, he says he's complaining of fever, headache, abdominal pain, and body weakness.
Body weakness. Okay. And could you ask him if his fever is consistent or intermittent?
All right. So zazzabin yana hawa yana soka ne ko? Okay. So his fever is on and off.
Okay. And has he been experiencing any dizziness or lightheadedness or shortness of breath?
Yawa akwai wannan ne numfashi mai wahala ko jiri. All right. There is no any history of shortness of breath or dizziness.
Okay. And has he had any stomach aches, constipation, or any nausea?
Yeah, he actually has a stomach ache. Okay, but no nausea and no vomiting.
No nausea, no vomiting. Okay. So if it's okay, can I get his temperature?
Okay, his temperature is reading at 7.9 degrees Celsius.
So a slight fever. Okay, so I think I would like to do a test. I would like to do a blood smear test. And I would also like to do a blood culture.
Okay. So the blood smear test is showing 2 pluses of malaria, while the blood culture is also positive for salmonella.
Okay. So can you ask him if he knows anything about malaria and how he might have got it?
Okay. Kaso na wakan malaria ko? Yeah, he knows a little bit about malaria.
Okay, so if you could just tell him that he probably got malaria just from being outside, he contracted it through a mosquito, and that it's important for him to, make sure he's wearing long sleeves and wearing insect repellent when outside.
Okay. So can you check? Okay, yeah, he acknowledges he had you. Hello, Kamryn.
Okay, and treatment-wise, it's only 2 pluses, so I think ACT treatment is the way to go.
Okay.
And also for future prevention, I would recommend getting a mosquito net and wearing insect repellent more often.
Yeah, that's good. So what about the typhoid fever?
Okay, and with the typhoid, I would like to treat him with an oral antibiotic since there hasn't been any vomiting.
Okay.
So with typhoid, could you just let him know to prevent typhoid fever again, or just from other people getting it? It's with better sanitation more hand washing, and making sure you're drinking clean water. And there is immunizations available. And if he can get one, I would recommend getting one.
Oh, that's really great. So Kajabunet Chiko. All right. He said he had all your tips he had all your tips on prevention, and that he's really grateful for it. Okay.
Thank you, Umar. I hope you feel better soon.
He's saying he's welcome. So about the diagnosis, are you hearing me, Kamryn?
Yes, I can hear you.
Yeah, okay. About the diagnosis, yeah, you diagnosed the patient well. So you did an excellent job. Okay.
Thank you.
Yeah, and for the treatment is also excellent. Excellent, excellent. Okay.
Thank you.
Furthermore, you can add antipyretics to your medication. All right.
Okay.
Yeah, and for the prevention is a superb job. So I'll just say congratulations.
Thank you so much.
Yeah, you're welcome. You're welcome.